Gonads are the organs that produce the gametes, the sex cells. Sperm cells in males, and the oocytes are eggs in females. Yes, females have gonads. The ovaries and the testes are gonads. But in addition to creating the sex cells, the gametes, these two, the ovaries and the testes, also secrete hormones. So let's look at each one of those, and we'll begin with the ovaries. So the ovaries are sort of oval shaped. They're located low in the pelvic cavity, and they produce several steroid hormones, including estrogen and progesterone. These two hormones, along with follicle-stimulating hormone and luteinizing hormone, remember we talked about those with the anterior pituitary, so these two hormones with FSH and LH are going to regulate the menstrual cycle, maintain a pregnancy if pregnancy occurs, and prepare the mammary glands for lactation. They also promote enlargement of the breast and widening of the hips at puberty and help to maintain these characteristics, which are called secondary sexual characteristics, throughout the female lifespan. The ovaries also produce a hormone called inhibin that inhibits the secretion of FSH. Of course, if you have just ovulated, then inhibin is going to prevent more FSH and LH from being released from the anterior pituitary. You'll learn much more about these hormones when we talk about the reproductive system. During pregnancy, the ovaries and the placenta also produce a hormone called relaxin, which increases the flexibility of the pubic symphysis. Remember, the pubic symphysis is that little fibrocartilaginous pad that holds the two pubic bones together. So it causes that fibrocartilaginous pad to become more gooey and have more give and more flexibility, so that can help for ease in delivery. And it also helps to dilate the cervix during labor and delivery. So all of these actions together, of course, is going to help the passage of the baby through the birth canal, through the vaginal canal. The testes in the male are the male gonads. So testes, T-E-S-T-S, is plural. T-E-S-T-I-S is singular. These are oval glands that are housed in the scrotum outside of the pelvic cavity. The main hormone produced and secreted by the testes is testosterone, which is an androgen. Remember, that's a male sex hormone. Testosterone stimulates the descent of the testes before birth. The testes develop inside the abdominal cavity, and we'll talk more about that when we get to the reproductive system. But testosterone helps to stimulate the descent of the testes into the scrotum before birth, regulates the production of sperm cells, and stimulates the development and maintenance of the male sexual characteristics, such as the male pattern of growth of hair growth on the face, and the deepening of the voice as it affects the larynx. The testes also produce inhibin, like we saw with the ovaries, which inhibits the secretion of follicle-stimulating hormone. And again, we'll talk much more about these organs and these hormones when we move into the reproductive system. The pineal gland is a very small endocrine gland that's attached to the roof of the third ventricle in the brain at the midline. The pineal gland secretes melatonin, which is a protein hormone derived from serotonin, and its role is to regulate your circadian rhythm, or your body's biological clock. So more melatonin is released in darkness than in light. So this hormone is thought, and has pretty much been proven, to help regulate sleepiness, okay? So when you have high levels of light, your brain is producing and secreting more serotonin. But as that light decreases as the light decreases, then the serotonin levels decrease and melatonin levels increase. So melatonin is sort of secreted in a fluctuating pattern, with low levels of melatonin secreted during the day and much higher levels at night. When you're asleep, the amount of melatonin in your blood increases by about 10 times and then drops back down to a low level again just before you wake up in the morning. Small doses of melatonin in little tablet form can be given, and that's helps some people to be able to sleep well and to reset their circadian rhythm. And of course, this is very useful to people that work night shifts, or if they work swing shifts and they alternate between daytime and nighttime work. and these low doses of melatonin can basically just sort of help to reset their clock. Melatonin levels are higher in children, and they decrease as you age and continue to decrease as you get older. And this is one reason, or one of the things that may be one of the reasons for decreased sleep in the elderly. Let's see. Oh, I wanted to tell you about seasonal affective disorder. This is a type of depression that affects some people during the winter months when days are short and nights are much longer. It's thought to be in part due to an overproduction of melatonin. This also is more likely to affect people that do work at night and have to try to sleep during the day. So they're producing more melatonin when they shouldn't be, right? And their melatonin and serotonin levels are sort of out of whack. Also, people that live in areas where there's a lot of dark, dreary, cloudy, gray weather, or in Alaska where they have prolonged periods of darkness, seasonal affective disorder is more likely to develop. So what do you do about this? Well, bright light therapy. Repeated doses of sitting in front of full spectrum light boxes on your desk or in your work area that's basically giving you just artificial light that's pretty much as bright as sunlight. That helps some people. Or get outside into bright sunlight if you can. That tends to help speed recovery, even if you're suffering from just jet lag, and that's when your body starts to think you're supposed to be asleep, but you're not yet, right? Or vice versa. Other things that have been effective for treating seasonal affective disorder are antidepressants known as SSRIs, selective serotonin reuptake inhibitors. And of course what these do is to prevent the serotonin from being reuptaken back into the presynaptic cell that secreted it. And by that serotonin staying in the synapse longer, it stimulates that postsynaptic cell for a longer period of time. And remember, serotonin was our happy, alert neurotransmitter. All right, the thymus is located just behind the sternum, between the lungs. It has a major role in immunity, in promoting the maturation and programming of the T cells. Remember, we talked about this with the immune system, but we mention it here in the endocrine system because of the hormones that are secreted, primarily the thymosin and the thymopoietins, and their role in the immune system. And of course that's been covered, so we'll move right on. All right, here you can see an image again. The pineal gland here located in the posterior part of the brain, and the thymus here in the mediastinum. And as you learned when we first started this lecture on the endocrine system, there are cells and organs that the organs are not classified as endocrine organs, but because they have cells that have an endocrine function and secrete hormones, we're going to include them here with just a brief overview of some of those. So the skin secretes cholecalciferol, and cholecalciferol plays a role in the making of calcitriol, and calcitriol is the active form of vitamin D. Gastrin. Gastrin is a hormone that's secreted by the gastric mucosa, and it helps to cause other hormones to be other digestive hormones and juices to be secreted, and increases the churning movements of the stomach. You'll get more of that when we get to the digestive system. The glucose-dependent insulinotropic peptide. Wow, that's a term there, right? It stimulates the release of insulin, so it sort of works synergistically with the beta cells to cause more insulin to be secreted. Secretin. Secretin is going to stimulate the pancreas to release pancreatic enzymes, and also cause the gallbladder to contract, to squeeze like a tube of toothpaste, and to squeeze bile into the duodenum. Cholecystokinin works as well to help those pancreatic juices to be released, and with the bile. So the cholecystokinin actually has a greater effect on the squeezing of the bile than the secretin does, and it also helps us to feel full after eating a meal. Human chorionic gonadotropin is released by the developing fetus, well before it ever becomes a fetus or becomes even an embryo. It is released by the trophoblast cells of the blastocyst, and it tells that corpus luteum to continue to secrete estrogen and progesterone so that the uterus stays thick and gooey and very highly vascularized to maintain the pregnancy until that placenta is fully functioning and secretes its own high levels of estrogen and progesterone. So I guess now you know the level or the role of the estrogen and progesterone from the placenta. So it helps to prepare the mammary glands, but causes the uterus to stay very highly vascular and very mucousy by increasing the number of blood vessels and mucus glands in the endometrium. This sort of got jacked up here. That N should be here, and it's just not fitting on the line. Human chorionic somatomammotropin stimulates the development of the mammary glands so that they do continue or do begin to grow along with prolactin. So these have a permissive and synergistic effect. The kidneys, we talked a little bit about the kidneys releasing renin when we talked about the renin-aldosterone or renin-angiotensin-aldosterone pathway. We've talked about erythropoietin already, a hormone released by the kidneys that stimulates the bone marrow to make red blood cells. Calcitriol is an inactive form of vitamin D that's released by the kidneys that helps us to be able to resorb calcium and phosphorus across the walls of the intestine. So the calcitriol causes the intestine to become more permeable to calcium and phosphorus so that we do get it back into the bloodstream rather than excreting it in the feces. Atrial natriuretic peptide. This is one I use a lot when I'm talking about the importance of terminology. So here's a big thing you've probably never even heard of. Well, let's see what we know here. Atrial. Well, you know about the heart, and you know the two upper chambers are the atria. Peptide, you know that's got to be something to do with a protein, right? So that leaves us with this middle word, uretic. Well, we know a diuretic causes us to increase urine output, so uretic, pretty good chance that it has something to do with urine. So far we've got heart, urine, protein. Now let's look at this part, natri. That one might not be familiar to you, but I guarantee you that you've seen the chemical symbol for sodium before. What's the chemical symbol for sodium? I knew you knew it. Na, right? That's natrium. So now we've got heart, sodium, P, protein. Yeah, you got it. So atrial natriuretic peptide is a hormone that is released by the atria of the heart, and it is antagonistic to aldosterone. Remember, aldosterone causes us to retain sodium and therefore retain water. ANP causes us to excrete sodium and excrete water. So by doing so, we decrease blood volume and then decrease blood pressure. And adipose tissue or fat tissue releases a hormone called leptin, and leptin helps to suppress our appetite so that we don't feel hungry. This is something that has been explored by several drug companies for weight loss over-the-counter products. Okay, so way back at the beginning we talked about hormones, and we mentioned lipid hormones and non-lipid hormones and eicosanoids. I told you we'd come back to these. So there are two families of eicosanoids, prostaglandins and leukotrienes, and they're found in almost all body cells except erythrocytes. They act as local hormones, so they're paracrines or autocrines in response to chemical or mechanical stimulus. They're synthesized or made by taking a 20-carbon fatty acid chain called arachidonic acid and simply removing a part of it. So you clip off a bit of it. So from arachidonic acid, different enzymatic reactions are going to produce prostaglandins or leukotrienes. Thromboxane is a modified prostaglandin that causes vasoconstriction and also helps to promote platelet activation. So this was one of those that was very briefly mentioned when we were talking about hemostasis with the blood. So eicosanoids are released in very small quantities, and they're only present in the blood for a very short period of time because they're degraded and inactivated very quickly. So the eicosanoids bind to receptors on target cells, and then they either stimulate or inhibit a second messenger system. So what does that tell you? Second messenger system, remember, that was what we talked about with protein-based hormones. So leukotrienes stimulate chemotaxis. Remember, we talked about positive chemotaxis when we talked about the immune system. So they stimulate chemotaxis of white blood cells and mediate inflammation. The prostaglandins alter smooth muscle contraction, how much a gland secretes, blood flow, has important roles in the reproductive processes, alters how platelets function, nerve impulse transmission, lipid metabolism, and the immune response. Holy cow, they have a lot to do, right? So they also have roles in promoting inflammation and fever and can intensify pain. So because of the discovery of how non-steroidal anti-inflammatory drugs work, we now know a lot about these prostaglandins and how these aspirin and other NSAID drugs are able to relieve pain. So ibuprofen and other NSAIDs. And what they do is to inhibit cyclooxygenase. Cyclooxygenase is an enzyme that's involved in creating prostaglandins. So remember I said that arachidonic acid had to be converted into leukotrienes or prostaglandins? Well, the cyclooxygenase, or abbreviated COX, C-O-X, COX is the enzyme that does that. So COX inhibitors, such as these NSAIDs, prevent that conversion, and by shutting down the production of prostaglandins, then you decrease the inflammation, the fever, and the pain. So the NSAIDs can be used to treat a lot of different inflammatory disorders, including rheumatoid arthritis. They also help to reduce fever and pain and inflammation. So it shows how this is working to decrease the action or the formation of this prostaglandin.